Hi, my name is Jocelyn Campuzano. My topic is case 339 and 2015 and 22-year-old named with hypoxemia and shock. Definition. Hypoxemia is an abnormal decrease of the partial pressure of oxygen in arterial blood order. Not be confused with hypoxia decreases oxygen diffusion in the tissues and in the cell. Shock. A state of the deep nervous and circulatory depressions without loss of consciousness, which occurs after experiencing a shock or a strong shock, a strong trauma or surgery.
Shock, or hypoperfusion, is the inability of the circulatory system to supply cells with oxygen. In early stages, symptoms occur as the body attempts to compensate for blood loss. Physiological causes of shock are the heart failing to pump, loss of blood volume, or blood vessels dilating, creating a vascular container capacity that is too great to be filled by available blood. Categories of severity are compensated shock, presents as an increased heart rate, increased respiration, and constriction of peripheral circulation, which results in pale, cool skin, and in infants and children, increased capillary refill time. Decompensated shock starts with low blood volume or lack of perfusion. Symptoms include falling blood pressure. Shock is irreversible when perfusion to the organs cannot be restored. Cell damage occurs, especially in the liver and kidneys. Even if vital signs are restored, irreparably damaged organs may cause death. The main types of shock are hypovolemic shock, caused by uncontrolled hemorrhage, internal, external, or both, or by plasma loss in burns or crush injuries. Cardiogenic shock occurs during a myocardial infarction or heart attack. Damaged heart muscle or electrical malfunctioning decrease the strength of the heart's contractions, causing a slow, fast, or irregular heartbeat. Neurogenic shock may result from the uncontrolled dilation of blood vessels due to nerve paralysis in spinal cord injuries. There is no blood loss, but the blood vessel dilation increases the capacity of the circulatory system, and available blood can no longer fill it. Sepsis, massive infection, or an anaphylactic or severe allergic reaction may also cause shock from blood vessel dilation. As an EMTB, you do not need to diagnose the type of shock. Instead, you must recognize and treat for shock whenever there is a mechanism of injury or signs that indicate the possibility of shock.
Applications in medicine. Although the root cause of cellular hypoxia is closing the capillary, it will always be useful to administer oxygen at relatively low doses and from the start of treatment. INSUI applied in Ecuador. The search for new early indicators for identifying tissue hypoxia may be important for the management of critically ill patients, as suggested by the few studies available that regard. The clinical community has embraced the idea that the different clinical trials that compare to treatment aimed to optimize it. There is a growing number of techniques that are being incorporated into the resources available in clinical practice to detect critical lack of oxygen at the level of individual organs. Among these techniques, state estimation, reduction, oxidation, and assessment of acid production are those that seem particularly promising. Pros: improving peripheral blood flow, creating new capillaries, improving the action of myoglobin and hemoglobin, creating a more efficient in its function. Improved pulmonary system, reducing its resistance to airflow. Improvement of the immune system, increasing the endogenous antioxidant systems on the organism. Thus, the response to infection with the potent antioxidant action is ensured. Cons. The carotid and aortic receptor stimulate as a result of a decrease in oxygen concentration in blood. Hyperventilation and respiratory rate increases oxygen sanguine. Low mental performance, including memory and the ability to solve mental problems. Conclusions. In severe diseases such as shock and hypoxemia, it is insufficient to determine the suitable oxygenation. In such situations, cardiac output, blood oxygen transport, physiological quiescence gained by experimentation in man in the foundation not only for the proper interpretation of the symptoms of diseases, but also for the accurate assessment of the effectiveness of normal compensatory mechanisms. Thanks.